Hello, friends. I'm Dr. Ashok Seth at Indialive 2024, and I have the pleasure to talk to my friend, Professor Flavio Ribichini from Italy, one of the very renowned interventional cardiologists who's our faculty at Indialive 2024 in New Delhi. Flavio, great to have you at the meeting.
Thank you. It's my pleasure.
Flavio, this was your perhaps first Indialive. And you've now been here for 2 days. What did you think of Indialive? I mean, everybody's been learning from you. Everybody's been wanting to learn more and more from you. What's the feeling and the spirit of Indialive that you feel?
The perception is a lot of energy and a lot of enthusiasm. A lot of people. I mean, it's not common to have such a crowded meetings in Europe. But above all, you perceive the need of learning. I mean, I can understand that the opportunities of going abroad are not as large as they are in Europe for these young people, and they really want to stay there. I mean, they stay in the seat from the beginning to the end of the session. All the sessions are fully packed, and this is, of course, rewarding for someone who is taking the flight, coming here, preparing the lectures, because you have the feeling that this is useful.
Yes, you're absolutely right. You know, one of the comments of one of our colleagues, faculties from abroad, when we said, why don't you give a lecture at the fellows course? He felt that it would be getting into a small room with 70, 30, 40 fellows and interacting. And he felt, is it really worth all my traveling a day earlier to be that? So when he entered the room to give the talk to the fellows course, there were 800 early career interventional cardiologists sitting there. And it was like a whole deluge of learners. You're right. It's so rewarding when they're absorbing it all. And then you know that they're benefiting in their daily practice because that's why they don't get up from their seats. So you gave a tremendous talk today on treatment of calcified lesions. In fact, imaging was a part of your emphasis. You've been a part of a number of consensus statements on these complex calcified lesions, but of course, complex PCIs. But more specifically, let us address what you said today and what was your messaging. So we're talking to a number of young career interventional cardiologists. Let's just say, what is your clear messaging around not just imaging, but treatment of severely calcified lesions? Who should be handling it? What should they really have in the armatorium? Just clear messages as if you were sort of concluding on your talk.
Well, I tried to say it in few words. I mean, calcified lesions are difficult, and they are very important in the long-term prognosis of patients because calcified lesions being difficult sometimes the procedure ends in a suboptimal result. Suboptimal results in underexpanded stents, not perfect bifurcations, too long stents. That translates into clinical events, which are major. I mean, these are not stupid things. These are infarctions or death or heart failure.
Yes.
So the operator should have this conscious and this responsibility of trying to do his best. Doing the best in calcified lesions required dedicated material, experience, and hopefully also the availability of having intravascular imaging.
Right.
But Ashok, you know that I was one of those pushing for having in our European consensus
to at least see Delhi, at least go to Agra, which is one of our wonders of the world. But I'm sure there's going to be next time because we've actually made you work really hard this time. And I'm sure. But on the other hand, you know, it is that if you travel such a long distance and your passion is teaching, your passion is education, your passion is training, in fact, you'd be so disappointed if you didn't have your hands full because you would have said, why did I travel all that way if I was only going to have, you know, a couple
10
of
people.
10 people or just 2 talks to give and the rest of the day I was free.
That was my first comment. I mean, you feel really rewarded to see the interest of these people attending your talks, which is not taken for granted.
No, but you know, your messaging has been clear, Flavio. Your experience has been well passed on, and we hope that we get numerous other opportunities for you to be in India, for us to be able to take our young career interventional cardiologists forward. And because we are expanding the base to such an extent that these young interventional cardiologists are moving to smaller and smaller towns and setting up cath labs, being a part of cath labs, are becoming the primary intake of the most complex patients because they're becoming the front line. And it's not the secondary and the tertiary centers. They're becoming the front line, and they're every day caught up with an MI with a cardiogenic shock. And they're right in the front line, in the small town, without any support systems. And they either have to refer or treat them themselves on site. And that's where we come in with these complex cases that you showed today, complex, the way to approach them. And those were the wonderful aspects of saying, here, guys, we are behind you. Our education is going to take you through some of those difficult moments.
I am thinking on your words, and you put it like it is no, I wouldn't say it a negative, but a difficult moment, because you say, yeah, we have more people doing this, but they don't have the experience of the technology to do more. But I would see it on the other way around. You have people taking care of patients now, and 10 years ago it was much less access to the medical care. So this is why I say you're doing great, because more cath labs, more colleagues treating patients in emergencies. I mean, we are saving lives when the patient comes to the cath lab with acute MI or with acute coronary syndrome. Stable angina is well managed by medical therapy and can always be referred to you with more experience and more technology.
Absolutely.
But it's very good news that you have young people, more cath lab taking care of your people.
And they're the front line. And we owe it to them to pass on this education so that they actually handle the patients.
Next step is making them better. But they are there already.
So thank you, Flavio. That was a great conversation. Oh, yeah. Let's not end it. What about your hobbies? Let me understand you more personally than professionally. So how do you spend, if you have any free time, how do you spend that?
I have very, very short time. When I was younger, I still, my love is mountaineering and climbing. But of course, I'm totally out of shape and out of time. But that is my passion, photographing and climbing. And well, at this age, what I am doing now is making wine. I have a small vineyard and I'm taking care of it. So I work like a farmer.
So next time, it's either you bring me a bottle or I come to your place and enjoy your wine.
That would be better.
And then I'm slightly amused when you say, at this age, because Flavio, you still you look young, and I've never thought of you as at this age.
Well, for climbing, there is a limit. Okay, for making wine, I can start. I'm just starting.
Flavio, it's been a pleasure talking to you.
Too.
We hope that you come again to India.
Certainly.
We hope that you're again at Indialive, and we hope that we can take this mission of education, teaching, training, and passing on expertise across boundaries.
Thank you, and congratulations for the job you are doing in that sense.
Thank you. Thank you, Flavio.